episode of Has Lecture Series. So today we are going to learn something on prescription, the most important component of clinical pharmacology, because you as healthcare professionals need to either write or understand a prescription so that drugs can be dispensed to the patients accordingly. Remember, prescription is a legal document, and it can be assessed at times when any problem arises. So it's a legal document, so you should be careful while writing and understanding a prescription. Now, what a prescription is? It's actually a order. It's actually a order by the healthcare professional, okay, by a healthcare professional, usually a practitioner. Okay, so any doctor or a dentist who has a registration name and has a license to practice, he gives a kind of a order. He gives a kind of a order to a pharmacist, and this order is what we call it as a prescription. Now, usually this order is placed in a written format. Okay, there is a piece of paper, you write the names of the drugs and so on, so it becomes a written order. Sometimes, very rarely, it can also be a verbal order which ultimately is recorded onto the paper. It cannot be that you don't document it. You need to document all drugs given to an individual. So verbal ultimately gets converted to a written document, or nowadays it can be a electronic formatting. You have so many softwares which you might have come across when you visit hospitals, and what you see is that the doctor usually places the order of the drugs he intends to give to his patients just by clicking onto that software and filling up the required column. So it's a kind of a order given by a doctor or a dentist to the pharmacist, and this order can be usually in the form of written, verbal, or electronic format. This order is usually for the drugs to be dispensed. Now remember, this order which is given to the pharmacist is usually for a specific patient for a particular medication. Okay, it's individual based. It cannot be that I am giving a prescription, okay, for 100 individuals by writing it on a single paper. It cannot happen. If a doctor is seeing 10 patients per day, he needs to write 10 different prescriptions, even though the content of the prescriptions in all those 10 patients might be the same. So he needs to keep it as one-to-one basis rather than keeping a 1 to 100 basis. So it's not allowed, it's not legal, and the doctor can be called to the court of law if he does that. So remember that it's a kind of a order for medications to be given to the individuals, and it's for a specific patient and for a specific medication. Now that is what a prescription is, how you define a prescription. Now next we will go to something else. Okay, as you know, in today's world, there are so many pharmaceutical industries across in the world who are usually preparing all kinds of medications. But that was not the case around 5-6 decades back. Okay, so usually the pharmacist used to prepare the drugs as per the orders of the doctor. Now this kind of a preparation by the pharmacist at the local level is called as extemporaneous pharmacy. Usually nowadays we don't have this kind of a pharmacy which is going on. Maybe you can find it at places, rarely, but usually what you find is a pre-compounding pharmacy. A pharmaceutical industry produces a particular dosage formulation and then markets it across that local area, national, at state level, or might be at the international level, and then this drug is directly given to the individuals at the orders of the doctor. For example, it can be what you can say, capsule amoxicillin, okay, tablet ciprofloxacin, tablet paracetamol. These things are not prepared by the pharmacist. These are prepared by the pharmaceutical industries, so they are pre-compounded before they reach to the patients and the doctors. So these are called as pre-compounding pharmacies. So that is what is usually happening across the globe. Now, drugs are available in various formats in the market. You should be knowing something about this before you start discussing even about prescription. Now, certain drugs which are called as OTC products or over-the-counter products. You do not require, remember the term, a prescription to take these drugs. If you visit any nearby supermarket or visit a pharmacy, you might find these OTC products been kept there. You can just pick up them. They're usually for minor illnesses and for symptomatic relief. You just need to pick that tablet or whatever, the syrup or whatever it might be. Just bring it home and just start taking it. Just start taking it without even taking the advice of the doctor. Usually painkiller drugs, antipyretic drugs might be available as OTC products. Remember, OTC products might change from one country to other country. What is available as OTC product in one country may be available as prescribed products in the other country. So they differ from one country to other country, but on an average should be available as over-the-counter prescriptions in that particular area. You do not require to go to a doctor to take these medications, do not require a prescription. The next in line are drugs which are called as prescription only medications. You require a prescription to take these drugs, so they are usually given by the doctors. For example, uh, injection, um, which injection should I be talking of? Injection cefotaxime, okay, third generation cephalosporin drugs. Okay, so you are not going to buy these drugs without the advice of the doctor. Neither the pharmacy is going to give this drug to you without a prescription. So you require doctor's advice, you require a prescription to buy injection cefotaxime, and that's what we call it as prescription only medication. Okay, so all kinds of injections, all kinds of higher order tablets, drugs, syrups, whatever it might be, are usually the prescription only medications. You require a prescription, a doctor's order to buy these products and take these products. The third in the line are the controlled drugs. Okay, controlled drugs. These are usually the narcotic agents which are used in therapeutics for one element or the other. The best example would be morphine. Now, morphine has an abuse liability. Okay, morphine can be taken for pleasures. So it's something which needs to be controlled. The use of morphine needs to be controlled so that you can control its use. At the same time, you don't allow it to go into hands of the bad people so that it can be misused. So you do not want it to happen. You do not want the drug to be used for abuse things and so on. So these drugs are then called as controlled drugs. These might be only available within the hospitals, especially the tertiary care hospitals, where these products are used for one thing or the other. For example, I've already given morphine. The doctor needs to be careful when they use these drugs because they need to keep exact record of how much quantity of the drug has been given, how much is in the storage, and so on. And they require to then submit this data at the end of whatever quarterly, one monthly, depends upon national guidelines to the authorities about the use of this drug so that it doesn't fall into the abuse liability. So these are called as controlled drugs. Now, once we know about the kind of products which are available in the market and how you then classify that, here we are only to just learn about prescription only medication. Now, something to add more to it is about dosage formulations. Now, if you don't know what a dosage formulation is, you can click onto my video on dosage formulations, drug dosage formulations, and find out. But anyway, just to highlight that we can use these abbreviations about these various dosage forms, and it has been accepted in a prescription. So for tablets, we just call it as tab. For capsule, we call it as cap. For syrup, SYR. If it's a suspension, then we call it as SUSP. Injection is ING. A meter dose inhaler might be MDI. A lotion as such is a lotion. So these are some of it. I have not added all the things, but you can use these abbreviations for the different dosage formulations when you are writing a prescription. Prescription also has frequency of administration. It's that tablet paracetamol. No, it is incomplete. Okay, how many doses of tablet paracetamol needs to be given? So this is the list of abbreviations used about the frequency of administration of a drug. Now, it's not that all these things are of important and you require to know the full forms of all these things, but which you will be using on a regular basis. Definitely, you need to know. So BID stands for bis in die. That's twice daily. So morning, evening kind of a tablet. Then what you have is CAPS. CAPS stands for capsule. Then we have HS. HS, you can see it here. HS, I can highlight this thing. HS, that is hora somni. That is at bedtime. So usually, kind of benzodiazepine tablets at bedtime. Then you have PRN. It's also important, used quite often. It is pro re nata, that is as needed. Okay, so you want to give an antipyretic tablet or a tablet which can bring down fever, then you don't require to give it like for all the time if the case is like that. So you can just tell them like if the patient has fever, then the patient can take it. Might be the same with anti-emetic tablets or tablets which can control vomiting. So if the patient vomits, then only maybe you need to give this drug, and so on. Then we have the QID, that is quartering die, that is 4 times a day. Then we have stat medications. Okay, somebody comes in emergency and you require to give a medicine immediately to the individual. Then stats is the one. Stats it stands for statin. That's immediately. I already discussed about tab. It is tabella. That is tablet. Then TID. Okay, that is ter in die. That is 3 times a day. So these are few abbreviations you may require to know if you are writing a prescription. Definitely you can just say twice a daily, thrice a daily, but it makes your job more difficult. But anyway, we are nowadays into the era of electronic prescription, so maybe that this is all embedded within the software, and you just need to click whatever it is, twice, thrice, 4 times a daily, as per needed, whatever it might be, and just add to it. But anyway, the basics of writing a prescription lie within these few terminologies. Now, coming to the prescription itself. So we have already seen something about prescription types of drugs, and then coming to slightly onto the components. Now let's see something upon the contents of a prescription. Now here what you see, my arrow here onto the screen, is alphabet P. P here stands for prescription. So this P as a red color alphabet here in capitals, and then you have these numbers 2 and 4. Now why 2 and 4? Nothing very specific about 2, neither about 4, just I need to explain you, so I'm just putting it down. So P, the level of the 2 is higher as compared to the P. So 2 is what we call it as a superscript. Superscript. Remember the term superscript. So script which is above the usual. So superscript. So 2 is a superscript. Okay. Then we have the P, which is a inscript. Okay, the main word, and then you have the 4, number 4 here. which is the level is down as compared to the P, we call it as subscript. Okay, so the components of prescription are a superscript, that is something which comes above the main headings of the drug. Then we have what's called as the inscript, in which we write something about the drugs itself. And then to end up the prescription, we also have closing, that we call it as subscript. Now, to be very specific, we can also be calling that as head, a tail, not a head, a body, and a tail. So a prescription has a head, a body, and a tail. Or in medical terminologies, it can be a superscript, inscript, and a subscript. Now we will see uh, something about what is in individual levels, what you can write, and so on. So as I said, a prescription can have a heading, also called a superscript, a body, which is the inscript, and then the closing, that is a subscript. Now the heading, that is something which comes above, even before writing the drug names and so on, does contain the name, address, and telephone number of the prescriber. So you as a doctor or a dentist, you need to have these columns filled up. Now usually what we see is that a pre-formatted kind of a paper onto which these things are already typed in. So it's not that you write it all the time. No, it's there. So it will bear your name, your address of the clinic, address of the house, if you want to have the telephone numbers which are available on usual lines, which might be available for emergency lines. So something about your professional you know things that you need to mention, so that whosoever reads this prescription knows that where this prescription has come from. Some prescriptions at this point also add to registration number. Okay, as a doctor or as a dentist, you will of course get a registration number for a particular area, for a particular state, for a particular country. So you need to write that medical council registration number here, so that it becomes more valid in terms of but anyway, people also add it to subscript, whatever it might be. You require to have your name, address, and telephone number, so that people can contact you, people can know where the prescription has come from if there is a doubt for it. The next thing is name, sex, and age of the patient. Okay, so name can be anything. Okay, XYZ, ABC, whatever it might be, name. A name does tell you about possibly the gender. Well, nowadays cannot say, but anyway, it might tell you something about the gender of the individual, might be something on to the religion of the individual, but this is all abstract. You cannot just correlate name with the thing, but it helps in identifying. It helps in identifying an individual, because it's the name that you are recognized in this world, isn't it? So name does signify so many things, but it helps in identification of the prescription, to whom it is addressed. Sex, okay, sex is important. A male, female, that's also one kind of identification along with the name. Plus, in addition, you have certain drugs which cannot be given in certain medical conditions. If a female with who is pregnant, maybe certain drugs are to be avoided. So by chance, a doctor has written a kind of medication without knowing that she is pregnant and so on. A rare episode, but does happen in medical practice. So the pharmacist can pick up that and maybe help in rectifying. So sex also does have a role to play, and it's very important to note the sex of an individual. Age of the patient, okay, what is the age? Definitely yes, also identification factor along with the name and the sex. uh, Again, age wise, we already have seen some of those drugs in my earlier series. You cannot opt to have give those drugs to individuals who are too young or who are too old. So maybe it's also a guiding line, also helps in identification, selecting a drug, and so on. The date of a prescription. Now this is most important, date of a prescription. Okay, you require to note it for legal purposes, because you are giving a drug to the individual. So know about it. When did you give it to the patient? That's one thing. The next thing is follow up. Okay, follow up. The patient has to come to you the next time. Okay, So you know when the patient last visited you, uh, have I mean how many drugs did you give it to him, the quantity, and whether he has completed taking those drugs and so on. So that's also becomes an important thing when you look at the date of prescription. From the patient's points also, it's also important because they then know when the prescriptions were given. Okay, there are cases old age people, amnesia. Okay, they forget things, so at that time, just looking at the date, okay, that was the date when my doctor prescribed me the medication and so on. So it gives you a brief idea upon the kind of history of the drug medications the patient is taking in. Definitely you need to know about the history of allergies, because all drugs can give rise to allergies, and you require to note it, ask it to the individual. So ask him whether he's suffering from any drug allergies or any other allergies, yes or no. That's important. And if he suffers from, just mention the drug name, so that the doctor can avoid, or you as a health professional can avoid giving a particular medication to the individual. So that was in short about heading. And now remember, prescription, how to write a prescription might differ from country to country. I'm just talking of the global scenario of prescription writing. Now, these components should ideally be there within the heading of the prescription. Now, that was about the heading, about the superscript. Now, let's look into the body, the inscript. So, something which describes the kind of medication the patient has to take. So this starts with a symbol of RX. You can see it here, RX symbol. So usually make a note that you require to write the symbol at the top once you just start writing the body or the inscript of the inscription. Now this RX sign is followed by, down to that would be the names of the drugs. So yes, it might be ciprofloxacin antibiotic, amoxicillin or ampicillin, or might be tablet diclofenac, which is a painkiller, or tablet paracetamol, which is analgesic antipyretic drug, or might be any complex chemotherapy given for cancer. So you should be writing the name of the drug, the name of the drug. Now remember, when you write the name of a drug, drugs are available in generic formulations, and are also available as what you call brand name formulations. Okay, so generic formulation usually will be a name given to that medication which is accepted globally. Okay, so it might be uh, atenolol tablet, a beta 1 blocker. Okay, atenolol tablet. So atenolol is a globally accepted name for that beta blocker. So you go across from one country to other country, the name atenolol remains the same. So that is what I'm calling of generic products, generic name of a drug. Okay, so that will remain the same across the globe. Okay, so you can either have a prescription written in generic formulations where you just stick to those names which are generic in origin. So might be tablet atenolol, or tablet propranolol, or might be ciprofloxacin, again coming to antibiotics, or amoxicillin. Okay, now the next thing in name of the drugs is to do with the brand names. Okay, so it might happen that tablet atenolol might be named as tablet attain, ATEN, tablet attain, in Southeast Asia. The same tablet can be named as tablet attain 20 in the United States. It's atenolol, but the brand names, the company gives its own name to its products. Now these brand names will differ from country to country, so sometimes doctors may also tend to write a prescription in the brand name format, because that is what they are after all looking at. They intend to give atenolol, but instead of writing atenolol, they just write as tablet attain, because it's the dosage formulation which is available in that particular area or the network. So that is something to do with the name of a drug. Now, once you know about the name of a drug, whether generic preparation or a brand name preparation, the next thing that comes to my mind is the dose size, concentration of the drug, and so on. So you require to know the dose size. So if I'm talking of a tablet, what I can call as tablet atenolol, again might be available as 5 milligrams, 10 milligrams tablet. Tablet paracetamol might be available as 500 milligrams or 650 milligrams, and so on. So it differs. So you require to know that dosage formulations in which it is available in the market, and you require to write it up when you are writing a prescription. At the same time, you are also supposed to know about the dosage formulations, as I said. So tablet atenolol. So tablet is a dosage formulation, orally given dosage formulation, or tablet paracetamol. Okay, or you can have injection cefotaxime. So injection is intravenous injection of cefotaxime. That's a third generation antibiotic. So you require to know the dose. You at the same time required to know about the dosage formulations, and you need to write it up in the prescription, because that is how the pharmacist sitting there is going to judge your prescription and then dispense the medication as per your orders. Okay, so amount to be dispensed. So for example, you require tablet paracetamol to be given twice daily for the next 3 days. So 6 tablets, sorry, so 6 tablets pharmacist needs to give to the individual for the 6 times it needs to be taken by the patient. And now directions to the patient. So whether the patient has to take the drug before the food, after the food, at bedtime, if at all he has certain symptoms like fever, vomiting, so in what conditions the patient should be taking it, so on. So those also can be referred in the body. So in the body of the prescription, in the inscription, you are supposed to mention everything about the drug. So it starts with the dosage formulation, for example, tablet, syrup, injection, followed by the name of a drug, which can be either a generic name or a brand name, depends upon the practitioner, followed by the dose, 500 milligrams, 1 gram, whatever it might be, followed by how many times the drug has to be taken, 2 times, 3 times, 4 times a day, or just when required, whatever it might be, and then for how many days, for 3 days, for 7 days, for 8 days. So these all things do make up the body of the prescription or the inscription. Remember, it can also happen that you have 3, 4, 5, 6, 7 drugs which are all listed into the body of the prescription. So body of a prescription might have many drugs with all these components listed, and it can become very complex for the pharmacist to read. So you need to write it very clearly, so that in eligible handwriting, so that pharmacists can just note whatever it is in the inscription. Now once you know about the body of the prescription, uh, you require to select the drug, isn't it? As I said to you about the brand names of the drugs. So there are various companies which are available and which can then have products um, of the same drug. So, for example, ciprofloxacin is produced by 10 different by 10 different pharmaceutical companies. So, which one of that you need to select? Or you might have tablet ciprofloxacin versus any other antibiotic. So, depending upon allergies which the patient might be suffering from, the available drug at the local market, the cost of the medication. So these factors do govern when you select a particular drug for the individual. You want to have a cost-effective medication, but it should suit to the disease. It cannot happen that you are giving for your benefit a second-line drug. No, it cannot happen. You require to move as per the guidelines when you are prescribing tablets. So it depends upon all those factors that you need to select a drug when you are talking about inscription or the body of the prescription. Now, once you know and selected a drug, written everything about it, the last part would be the closing end. Now, at the closing end, you require to sign the prescription. Without a valid signature, the prescription is not valid. It needs to be signed. You require to also have a registration number placed here, but some people placed it higher up into superscript. Depends where you want to have that thing. Refill instructions. So you do not want your patients to just come back after every 7 days, especially for chronic illnesses. You want them to visit you after 3 months, 4 months, or whatever the reason might be, or the disease might be. So you require to have those refill instructions. Okay, so every time the patient need not meet you, he can just go to the pharmacy, take the drugs, and can go back. So refill the same drugs after 1 month. So those refill instructions needs to be given. It avoids complexities, and especially the long queue ups in the doctor's cabin. So you require to have those refill instructions filled up so that patients can directly reach the pharmacy and can take the medication in that required time. Correct? Generic substitution instructions. So you require to have, if at all, this is not mandatory, but if you don't get this drug, maybe you can try another drug, something on that sort. So it might help the individual to just come up, but again, it's a controversial thing, uh, whether to give those kind of instructions or not. Better to avoid them. But signature, registration number, and refill instructions do carry a lot of meaning when you talk of the closing end of a prescription. Now that is the kind of model prescription that I was talking of. So the name of an individual, XYZ, then the date. This is of course the future. So 2nd of June 2014. So like I will be writing this kind of prescription. The age of the individual, the sex is male patient, 35 years old, no drug allergy. So these components, okay, these components, name, age, sex, date, are the superscripts, are the components of the superscript. I already discussed with you why you require to have these components, why it is essential. Do not leave any columns blank. No, it's not allowed. Your prescription is not valid. This patient suffers from viral upper respiratory tract infection. Okay, so that's the diagnosis. Now this is the body. Now you require to start it with the term RX. Okay, you require to have this symbol placed here, and then I will give this patient tablet paracetamol 500 milligrams. So tablet is dosage formulation. It's a tablet, orally given tablet paracetamol. This is a drug name, again a generic name. This is valid across the globe, but this drug can be available as tablet Panadol in the part of the world where I am staying. If you go to some other word, some other place, this tablet paracetamol might be called as something else. So this is a generic name, but then Panadol, his company name, is a brand name. You can have prescriptions as tablet Panadol also, but depends. I usually go for generic kind of a prescription. So tablet paracetamol, so drug name. Dose of the drug, so 500 milligrams. I intend to give 500 milligrams of tablet to the patient. TID, frequency of administration, so 3 times a day. 3 times a day the patient needs to take it orally, given the instruction to the individual for 3 days. Okay, so tablet paracetamol 500 milligrams 3 times a day to be given orally for 3 days. Okay, so this is a complete form of prescription. Okay, now it's upper respiratory tract infection with less of secretions, and it's mild variety. So I do not intend to give anything else except for analgesic antipyretic drug like that paracetamol. Along with that, I can give mouth gargles. Mouth gargles. That's given BID twice daily, morning and night time, for oral routes, not to swallow. Okay, it's not something that the patient should swallow. Just need to gargle it up morning, evening for the next 3 days. So a very simple prescription, very simple prescription. Now it's not something that that I have not added on to other drugs like antihistaminics, sorry, or what you call it as antibiotics. I just keep it very simple for you guys so that you can know what a prescription is. So in those terms, these things, the RX sign and these all terminologies become the Inscript. Now this prescription will be followed by a Subscript. So Inscript followed by a Subscript. I need to sign here, and that's on the name, and that's my registration number. Now this is a model prescription. Now here in that I can also write up here. Important is the name of my clinic, uh, the address, phone numbers, and so on. So that's what is something missing up. I hope you got it, but I deliberately kept it so that you can just point it out. So it requires my clinic name, address, phone numbers, and so on in the superscript. So that is patient information, but even the doctor's information here is required. So these are components of superscript. These are the components of inscript, and these are the components of the subscript. Without all these things mentioned, the prescription is not valid. Is not valid. Even components, all these components of a drug are important. You miss on any of these components, the prescription is not valid, and it can be sent back to you for further rectification. Now that was a very simple thing on prescription, but you require to maximize the patient safety. So always write legibly. Uh, Handwriting should be good. Always space out words, numbers to avoid confusion. Okay, so spacing should be okay. Try to avoid decimal points. If you are using a decimal points, for example, you are using something like 0.1 milligrams, then mention 0.1 milligrams, write it very, very clearly. Okay, or if you're just writing 1 milligram, just write as 1 milligram. Do not write as 1.0 milligrams. It might be taken as 10 milligrams. Okay, so that decimal fraction should be taken very seriously, because that can totally disrupt the entire nature of your prescription. The patient can land up into uh, side effects of a drug. So when writing prescriptions, when putting up decimal points, you are required to maintain order so that the pharmacist can clearly see it and can give the drugs accordingly. Always complete medication orders. That's important. As I said, do not leave any of those columns blank. It might prove to be a problem to you in the future. Avoid abbreviations. But anyway, as I said, a few of that, like tablet paracetamol, you write as tab, or injection as injection, or injection as ing. It's okay. But tablet paracetamol. So the paracetamol should not be like para. No, tablet para usually doesn't carry any meaning, and it can again put the pharmacist under confusion. When in doubt, ask to verify. Okay, so if you come across any kind of prescription where you find there is a doubt, maybe it's time for you to verify. The pharmacist can come up to you. You require to religiously look through the prescription and then again rewrite it if at all you feel so. And always prescriptions should go as per the guidelines which are mentioned for the management of a particular condition. That is always you need to remember it at the end of the day. Now that was a very short analysis on how to write a prescription. I hope you will get across many prescriptions when you are visiting clinics, hospitals, and so on. Try to just prescriptions. Try to understand the components of prescription. Maybe you just want to write a prescription for your patient. For you just start writing those prescriptions for abstract kind of patients with different conditions, which will help you to practice on prescription writing and so on. So I hope you like this session. Do continue watching my channel. Please subscribe. Thank you. Bye.